All right, welcome. So glad to have you with us for our panel session on building relationships and working with local officials. I'm Renee Parks, and I'm with the Prevention Research Center at Washington University in St. Louis, and joining from St. Louis. I think it'll be helpful as we get settled into our space if we know who you are, so we know who we're sharing this space with. So if you would, please, in the chat, can you put your name, your organization, and where you are joining from or your location, okay? So help me out by putting that information in the chat, your name, your organization, and where you are joining from. Excellent. All right, so this panel session is made possible through a project collaboration between our center and four community health coalitions: Be Healthy QC, Butler County Wellness Council, Healthy BR, and Live Healthy Miami Gardens. This is part of our center's multi-year core research project, which is funded by the CDC. And the overall goal is to develop and share strategies that support the use of effective policies and policymaking at the local level to advance community health equity. Just a little bit of housekeeping. If you haven't already, please mute yourself. There will be some time for you to unmute yourself later in this session. I'll talk to you more about that in a moment. Also, I'd like to note we are currently recording. We're going to record through the moderated discussion, and then the recording is going to be stopped before we have the audience Q&A. So just so you're aware of that. And we will share the recording as well as an accompanying guide and resource document after the session. So our team has worked on compiling a lot of great resources and information on how to work with local policymakers and some best practices. So please feel free to share these with colleagues and partners engaged in the work of advancing community health equity. So let's see. Here's our roadmap for the session. So the goal of the session is to help you gain a greater understanding of what policy engagement and policy work for community health equity looks like, especially at the local level. And we want to do this by hearing from folks who are doing it, those who are or have been engaged in policy, education, and advocacy efforts, as well as hearing from those who serve or have recently served as a local official. They provide really great perspective and insights. So I'll introduce our panelists, and they'll have some time for brief remarks. And this will be followed by a moderated discussion, and then there will be time for you all, the audience, to ask questions of our panelists, and then we'll just wrap up. So I just want to note that you're welcome to put questions in the chat at any time. I will look to the chat, make sure that we're doing good on time, and if we haven't covered those questions already, we'll save those for the audience Q&A portion. And I also want to note that this session was really developed in response to some feedback from contacts with a couple of our collaborating coalitions, indicating that this topic would really be helpful to learn more about. And we know how important and valuable it is to build relationships and work with local officials and policymakers to be able to advance community health and equity. We had some key findings from interviews that our team conducted with municipal officials that we did earlier in an earlier phase of this project. Those findings really emphasize the important role of community organizations as serving as intermediaries, influencing policymaking for community health by really building relationships, especially among community members most impacted. Community organizations really have this role and really can elevate an issue, provide local data and information, and really help to identify and secure additional resources to address the issue. And there's also the understanding that policymakers at the local level make decisions across a variety of issues, and addressing these issues requires collaboration. So it really puts community leaders and organizations in a position to and a need for these folks to educate officials and help really show the connection between health relevant policies and their impact across sectors, including transportation and housing, and to better frame messages to the social and political context, and really step into this facilitator role of being able to facilitate collaboration across departments, other levels of government, and even among other organizations. So yeah, let's dive into this topic further. I'd like to introduce our panelists. We've got three amazing folks joining us, Grace Kyung, Kelly McGowan, and Ian Thomas, and I'd like to introduce them to you all. So I'm going to start off with Grace first. Grace is the Senior Strategic Initiatives Manager for Mayor Tishaura O. Jones for the City of St. Louis. She has worked in the subject areas of public health, healthy communities, built environment, transportation planning, housing, and planning as a systems thinker to dismantle the root causes of inequities to improve the quality of life for individuals. She was previously the campaign director for the COVID-19 Regional Response Team, where she oversaw campaigns focused on medical and behavioral health supports for unhoused neighbors, eviction prevention and tenants' rights, PPE distribution, and vaccine education. She was also a project manager at Urban Strategies Incorporated to work in East St. Louis, Illinois at Samuel Gompers Homes, and a special projects director at TrailNet. Grace holds a Bachelor of Science in Community Health, Master of Public Health, and a Master of Urban Planning from the University of Illinois at Urbana-Champaign. Welcome, Grace. Next is Kelly McGowan. Kelly is the founder and executive director of Transform 314 and special projects coordinator with Missouri Center for Public Health Excellence. Kelly is a proud St. Louisan and health equity advocate. Armed with a Bachelor of Science in Exercise Science from St. Louis University and a Master of Public Health from Washington University in St. Louis, Kelly worked as a Healthy Harlem coordinator in the Harlem Children's Zone, where she spearheaded nutrition and fitness education among students in Central Harlem. After leaving New York, Kelly returned to St. Louis, where she served as the wellness director for Women Empowered to End Disparities in Obesity at the Gateway Region YMCA. In her role, she worked with North St. Louis County mothers and caregivers to create healthy changes in their schools and communities. Kelly has participated in various panels and has been featured in print and radio appearances addressing health equity efforts in the St. Louis region. Most recently, Kelly has founded Transform 314. Through this effort, Kelly is working to amplify community and local decision-making processes to ensure all St. Louis neighborhoods are designed for their inhabitants to thrive. Welcome, Kelly. And then finally, we have Ian Thomas. Ian is the state and local program director for America Walks and past city council member for the city of Columbia, Missouri. Ian is a veteran of the Walkable Communities movement. He served on the America Walks board of directors for 7 years until his appointment as state and local program director in September 2014. In 2000, he co-founded the PedNet Coalition of Columbia, Missouri, and led the organization as its executive director for 13 years. Among several accomplishments, he coordinated the campaign to pass Columbia's Complete Streets policy in 2004, one of the earliest such policies in the U.S. From 2013 to 2022, Ian served as an elected member of the Columbia City Council, where he championed adoption of the city's Vision Zero policy and launched several new community initiatives focused on health equity and sustainability. Ian and his wife now live in a co-housing community in St. Louis Park, Minnesota. Welcome, Ian. Let me stop sharing. And I'm going to actually, I want to give each of our panelists several minutes to share any remarks, any really key information that they'd like to share on this topic of building relationships and working with local officials. And I'm going to start with you, Grace. I'm going to give you the floor, and I'm going to go ahead and pin you so you can be front and center. Yay.
Renee, that seems unfair if you didn't pin yourself. But thank you for the warm welcome. Hi, everyone on the call as well. I'll keep my remarks short because I'm someone who likes open discussion, dialogue, and just getting the chats together. But I think Renee did a great job highlighting my role in the mayor's office. And so coming into government, I've never worked in government before. And so it's been eye-opening to better understand how to be a better advocate if I were to ever leave this role, but also how to work with advocates myself. So one of the things I'm always trying to practice and bring in is how we currently do our work and how we can improve it so that we're ensuring to work with community, not over-engage community, and ensure that the work is driven with principles of equity and inclusion and how we do that. So a lot of my work, as Renee shared at a high level, some specific things I work on here are related to transportation, housing, vacancy, planning. So just excited to meet you all.
Thank you, Grace. And I'll remove the pen. Kelly, I want to give you the floor, and let me go ahead and pin you so you can be front and center.
Awesome. Good afternoon, everyone. Really excited and appreciative of being able to share the space with y'all on such an important topic. I'm going to keep my remarks really brief as well to make sure we can get into the good stuff and some real authentic dialogue here. You know, as the awesome, warm introduction provided, I have been fortunate enough to really do a lot of work starting in the programmatic space when we're talking about really centering health equity and ensuring thriving communities for all, and going from the programmatic space and pivoting and shifting into policy and advocacy work to really figure out how we collectively as residents can drive the policies and just really play a real role and a shape in designing our communities, which we know are really the core root when we're talking about health and equities. And so I will say, from a lot of my experiences from the programmatic space and now for the past few years focusing on some policy and advocacy work, my approach is it's teamwork. And I know it sounds like really cliche, and we'll get into it a little bit on in the conversation, but I come from a team sports background. And so that's how I approach everything that I do. And especially when we're talking about working with, and I'm saying that, working with decision makers. We all have a role to play. We are all looking to, achieve the same thing. And so really making sure that and as an advocate, I express myself as being a partner and knowing what our role is on that team to really accomplish and achieve the best communities that we can be. And so I always really lean in with that. And I think that's where I've been very successful, is that we're all in this together. We all have our respective lanes, our respective strengths, as well as weaknesses, our respective networks, and ways that we can be successful. And if we are able to leverage all of those strengths, they all really add up and build up. And that's what we need to really move things forward. So really looking forward to the conversation, sharing, again, some specific examples. But remember, y'all, teamwork makes the dream work.
Thank you, Kelly. And then Ian, you're up next, and let me go ahead and pin you.
Well, good afternoon, everybody. I'm really glad we're having this conversation about relationships between community coalitions trying to make change and improve the community, and the public officials who are elected to ultimately make those decisions. It's a critical piece of the change process. And I was going to start with just a couple of short stories about my sort of experience in this space. In the early 2000s, I had recently moved to Columbia, Missouri, a college town of about 120,000 in the middle of Missouri, and got involved with an existing coalition that was really looking to improve walking and bicycling connections across the city. And we, plotted together and started doing outreach to the community and started talking to the officials at the city, and eventually realized that what we needed to do was to get a policy change so that the standards by which the city of Columbia was designing and building streets would include really good facilities for walking and biking and rolling in a wheelchair or other mobility device. And that is now well known as a complete streets policy, although that term was very new at that time. But we didn't really know what we were doing. We kind of followed our, instincts and hunches. We went out to sort of public community events and had information. We started learning that other cities were doing something similar. So we shared that information. We went along to city council meetings. We tried to connect with the officials, and we did with some, and others it was more difficult. And we eventually, developed a policy in partnership with some people inside the city, which was passed in 2004. Many, many years later, more than a decade later, I was a member of that same Columbia City Council, and we had a spate of pedestrian fatalities. I think there were 8 in Columbia in about a 6-month period. And I, was obviously very concerned about this. And even though we passed the complete streets policy, a lot of streets had not yet been redesigned. That's a slow process, even when you have a complete streets policy. So I talked to other members of the council and the mayor. The mayor went ahead and set up a task force on pedestrian safety. And I was one of a pair of co-chairs for that. And at that time, Vision Zero was another policy approach that was kind of gaining traction across the country. Our task force met for almost a year, studied the incidents that had happened, researched best practices in other communities, and eventually came up with a formal recommendation to the whole city council to adopt a Vision Zero policy, which would really hold the city accountable to reducing not just pedestrian deaths, but all traffic deaths by a certain date. And that policy was eventually passed. The date is 2030. If they are on target, I don't live in Columbia anymore. If they are on target, then I would hope that those, number of traffic deaths every year are heading downwards to get to 0 by 2030. And that policy left it to the traffic engineers and the planning professionals to figure out how to do that. We had a lot of advice, and reducing traffic speeds is the key piece of advice. So I'll hand it back to you, Renee.
Thanks, Ian. I'm going to bring all of our panelists, because we've reached the part where we're going to have our moderated discussion, moderated by me. So let me go ahead and all of us, including myself, I know I need to be up there. All right, so I've got some questions, and I am so eager to really hear from y'all. You bring a great deal of expertise and experience. So I was with this first question, I was really thinking about it in terms of the work that Kelly, you as well as Ian do, but Grace, I know you have a lot of great experience in this area as well. You're in an official capacity, local official capacity, but like you said, you have been engaged in the other side for quite some time. What are some key effective strategies you've used to build relationships with local officials and local policymakers?
I'll kind of start first, and then my other esteemed fellow panelists can definitely chime in for sure. I'll say step 0, yes, step 0 is just understanding like the landscape, right? And the who does the what, the why, and the how. So really take the time to learn, again, what is it that you're pushing for, right? What is the issue? What are you trying to accomplish? And who who's the person, the decision maker or decision makers, like who has the power to really address it and change that, and really take the time to understand that. Again, that's step zero. And I'm being intentional about saying that because I think sometimes that gets missed. We want to make things better. Trust me, I understand. But in order to be an effective advocate, you do need to have that understanding of who's, the main players involved, and also getting an understanding of just a lot of the social, political, just the circumstances at play. I think that's really important to know before you kind of get involved in anything and reach out to anyone. So again, know the who, what, when, where, and why, how things work, and understand some of those processes first. And do some research, do a little intel, really get to know who these folks are, what are their priorities. You can also, do some intel by checking out some of these meetings, just to get a sense of how folks move, what's really important to them, get a sense of, again, who do they represent? I would say kind of starting there first, and then from there, just thinking about, in your own personal lives, in developing and, maintaining, sustaining relationships, what does that think? What does that mean? And what does that look like? I have made it a point to not initially reach out to an elected official because I was asking them for something. And I know sometimes life's, and sometimes there are things that are beyond your control, and maybe you do need to have those like reach out moments. Hey, we need this. Ideally, make sure you just reach out, have a conversation with your elected official just to get a sense. So number one, they know who you are. They know what your organization, the work that you're doing, what y'all's priorities are. And I think it kind of lays that foundation to kind of really begin to explore opportunities for a partnership. And I think the last thing I will say is being present as well. Whether that's going to any local governmental meetings, whether that's hanging out in some of the spaces and places in the jurisdictions of where those elected leaders maybe are, going to different events and spaces, because I think when folks see you consistently showing up, people take you a little seriously, and they also see that you are genuine and you authentically care. And so I'll leave it there for now. But those are kind of some of my initial thoughts in your question, Renee.
Those are excellent initial thoughts. And boy, I'm like, I have some follow-up questions, but I'm going to hold those. I want to hear from our other amazing panelists. Ian, did you want to chime in?
Yeah, I agree with everything Kelly said around doing the research and preparing for those relationships. Another thing that you can do is invite some of those officials to participate in events and programs that you may be organizing around your issue. In our case, working on pedestrian safety and building complete streets and encouraging more physical activity in the community, our group had a walking school bus program going, and you may be familiar with that. It's sort of a partnership between the community and the school district, where the school district will help promote the event, but typically you need kind of outside volunteers. You need to do quite a bit of work to figure out where the kids live and to advertise this effort, and kids sign up, parents' permission and so on. And then the adult volunteer walks around the neighborhood and picks up the children at their homes, all walk to school, and then the same in reverse in the afternoon. So that's a great opportunity to invite the mayor or member of the county commission to come along and walk with the kids. And I found a range of different public officials have really enjoyed that. And especially if we invite the media to come along and take a photograph. It's a great, maybe around election time, it's a great photo op for somebody to show they're out there with members of the community. And then it also puts them on the record of being supportive of this, so that later when you are asking for a policy change, you can remind them that how great it was to have this walking school bus program, and what a shame it is that in some parts of the city the sidewalks aren't there and those kids cannot walk safely to school. A couple of other ideas, some kind of a summit, a health summit, a walkability summit around the issue, perhaps have some invited speakers coming in, and then invite the elected official to come and make some opening remarks. And again, it's a sort of a similar strategy to get those officials kind of on the record in public as supporting the general issue, so that when there's a policy question coming up, they've kind of indicated their support already and are more likely to follow through with that. And then a bigger picture strategy that I've seen work really well is to just create a kind of in the background, as it were, let's call it healthy community partnership, and invite this is typically, it'll include elected officials, but it'll also include government staff members from the public health department, from the planning department, from the traffic engineering department. If you have a college or a university, some representatives from there, from the school district, from various nonprofits and so on. And set up not a time-consuming structure, but maybe an annual dinner and awards banquet and guest speaker, and ask people to sort of sign an MOU that they're part of the Healthy Community Partnership, with a general, willingness to consider some specific partnership activities if an opportunity arises. And that, again, you can use that with maybe a monthly newsletter that goes out to that larger partnership to sort of seed ideas that might evolve into potential policy changes that they might then support.
Thanks, Anne. Yes, I love that. I really do. Pulling in, having the official on the record as supporting that issue, but also for them hearing about like these opportunities for how they really have a role in this, and here's what role they have. Here's how they can play that role. So that's great. Thank you. Grace, I don't want to leave you out. If you have any like comments that you'd like to share to add on, or we can certainly continue, because I got the next questions directed at you. Oh yeah, sorry.
No, you're good. I was going to say happy to add, but if you want to keep us moving, you can ask the next question.
Why don't you? Let me just ask the next question, because I'm thinking of you in particular, as well as Ian and your roles as local officials or past local officials. So what are some ways you have seen community level practitioners effectively engage with local officials and policymakers?
I think that there's many different ways to engage with local officials, whether that's the mayor's office or the Board of Aldermen. Locally for here, Board of Aldermen is our city council, essentially. I think one of the things that is always helpful is folks understanding the different branches of government and how we function. So I think sometimes people don't reach out to the mayor's office in not realizing that any of our city departments report directly to the executive branch. And then, of course, our city council / Board of Aldermen is our legislative branch. So I think, Kelly, to give your group kudos in understanding how that works and the work that Transform 314 is doing to help educate that in the community, I think is super helpful, because it does change how you interact with our city departments in that respect of understanding what our city departments are doing, because sometimes I think politics can get in the way of allowing city departments to actually function and how they do their work. So in terms of like community practitioners, I think with that general, just taking a step back and understanding who's the appropriate party to advocate with or like to work with to make change happen. Because we know that our city departments, I think across the country, are particularly city staff are overworked, overburdened with less resources to do that work. So I think anyone who comes in to understand how things function and ask genuine questions so that they can better understand how to work within the existing system. I'm not saying the system is always working for the community or residents, but just taking a step back to understand it has always been super helpful. And so that's something that I've just come to learn to appreciate more working within government, that I always joke, if I ever leave this job and I'm a community activist again, I would approach government differently because of just getting to now meet the staff that have to do that work with limited resources and understanding what they're doing to do the job that they have. I have a huge, deep appreciation for city staff that I didn't realize it could get deeper in understanding once I really understood the people and the work that they have going. So that's probably my biggest advice to any practitioner out there, really getting to know like how your local government functions and partnering with groups like Kelly's who are trying to educate and bring people into that process. But also just, I think it's a vice versa thing of community practitioners understanding different neighborhoods or residents that they want to work with and understanding previous engagement that's happened there and the roles that universities or large nonprofits and other partners can have. And so I think it's kind of a both and of understanding different systems and structures before just inserting yourself into thinking you know how to help solve a problem.
Yeah, thanks, Grace, for lifting that up. And the policymaking process, understanding that, like that step zero, like Kelly said. Ian, did you want to add anything?
Yeah, when I think of the term community practitioners, I see two distinct groups. One being, grassroots advocates, possibly volunteers or even staff with nonprofit organizations, as well as members of the public who care about a particular issue. It could be anything. It could be better walking and biking conditions, but it could be, tougher laws to restrict smoking in public places. Or there's a whole range of different sort of health-related campaigns that people have been involved in. And then the other group I put in that category of community coalitions is government staff themselves. So the local public health department, the county health department, or the state health department, and other, in my experience, the public health department are the most ready to try to push for change that I'm aware of. My general prejudice about planning departments and traffic engineering departments is that they try to keep things the same, whereas they're more conservative and public health is more progressive, sees the problems in what we're doing and wants to change things. But I think that there are progressive movements within the planning profession. I think partly because the public health profession has really influenced the planning profession, and other sectors have influenced planning. So it could be a range of different departments, and community engagement. A lot of cities and counties have community engagement coordinators. That would be another city staff position that may want to support the change. So just sort of thinking about those two groups, if you work for the local government, you are restricted, you are limited in the ways what you can say and what you can say in public. You're more limited about what you can say in public than what you might be able to say behind the scenes. But different ways to engage would be by producing some professional reports about a particular issue and presenting that to the elected body, to the legislative body, and a lot of cities have citizens advisory boards. So I know that in Columbia, Missouri, there's a public health advisory board, which meets monthly, which citizens are appointed by the council, and they take on issues, and they work closely with the public health staff in that department. So if you're a public health staff and you want to kind of get some messaging up to the legislative body, then you can work collaboratively with your Citizens Advisory Board to develop arguments and recommendations. On the other hand, those kind of grassroots advocates, in some ways, they're freer and can do more. They can go to a city council meeting and say whatever they want. And they can write a letter to the newspaper, and they can, call up the local TV station and say, I've got something important here. I want you to cover this on the news. But they also have less power because they're not part of the local government. So a lot of that work is in the area of organizing and campaigns. And they can also work through citizens advisory boards. It's true that any citizen can run for, public office, get on the local city council, but that's often a big lift. An intermediate step is to run for one of those advisory boards, the Public Health Advisory Board. And if you're a grassroots advocate trying to get some change in health policy, then a great step might be to look for a vacancy on the Public Health Advisory Board and run for that and try to get in there, because then you will be, a couple of steps closer to the kind of decision making that you want to influence.
Excellent. Those are some really great thoughts. I love that idea of looking for a vacancy in a citizens advisory board. Yeah, that lands with me. I'm like, whoo, is that a next step for me? Okay. And Kelly, I don't want to leave you out, so feel free to chime in. I know you're like, you're in. This next question is for all of you. What role do you see community level, local level practitioners playing in influencing policy change at the local level, municipal, or even county level?
I'll kind of get it going here. And I think you mentioned this earlier, like kind of when you were kind of setting the stage for the conversation, Renee, about some of the research that you had done around how, and I view myself in a lot of the roles that I play as that intermediary or middle woman, or in slang terms, the plug, between kind of that bridge when we're talking about I'll say decision makers at the local level and the community. And so pretty much all the work I've done, I do have a public health background. And so, I do carry that, I carry that, a lot of that skill set and those tools and that experience and expertise with me. That a lot of our decision makers, and again, something you really hit on earlier, Renee, is that the truth of the matter is that, these decision makers are literally deciding on things from all areas, right? From A to Z in all aspects and areas of living, of life, of, different regulations. And there's not one single human being that knows all of the things there is to know about all of the things when we're talking about elected leadership. And so really leaning on and finding not only just content experts, and also I think making sure that you understand the pulse of the community, the pulse of the people, right, you represent, and really what are some serious issues, what are major concerns that people are dealing with, and kind of like bringing it, amplifying it, right, and then also, like I said, making sure we are able to have those conversations, amplifying the things that community members have expressed are really important issues to them, communicating that to the decision maker, and also making sure that a lot of the things that decision makers, maybe some of their the things that are considering, or maybe there are some circumstances around their role and their authority, also being able to communicate that. And I think a lot of the work that I've done professionally, and especially now through Transform 314, we really serve as that convener. We hold monthly, we call them monthly meetups. And based off of data we collected from community members last early fall to really get a sense of specifically what Black St. Louisans are passionate about when it comes to improving their built environments. Overwhelmingly, people are tired of our unsafe, and as I say, jacked up sidewalks and streets and traffic infrastructure. And so every month, we serve as a convener, as a space for content experts, elected and appointed leaders to have conversations in space with community so we can, again, come together to really address the core issues of why our infrastructure is literally crumbling and putting us all in danger and at risk from a plethora of, deaths, injuries, and a lot of other adverse health outcomes. And so I think from that lens, again, just really being that intermediary, really being that connect point to make sure that we can, again, connect with community, make sure we're amplifying and getting that message up to those that are making those decisions, and also allowing the space for folks that are making those decisions to also connect with, hear from their own mouths and get a better sense of really what are some issues and how are the decisions that they are making impacting community. And so I really lean in that space as a convener and as that intermediary.
Yeah, I'm glad you brought that up, Kelly, and you really lifted up what that looks like. The staying in relationship with the community or communities and neighborhoods and really having a pulse. So yes, you did that really great effort with the needs assessment, the surveying of what Black St. Louisans really want to see, and then the ongoing conversations. Because I feel like sometimes that's maybe not lifted up, or maybe a lot of the connection with organizations or entities that are doing that are not saying or not plugged in to enough. So as that intermediary, as that expert, you really are staying connected in relationship with those who should be heard, who are most impacted. And then that information and those folks are empowered. And then that information is also connected through the relationships that you've garnered with local officials. So thanks for lifting that up and articulating that so well. Ian and Grace, would you like to add anything additionally regarding the role that you see community level practitioners playing in influencing policy change at the local level? And I know you've already shared a great deal of really great insight.
I think Ian and I are laughing at each other. We're both like, should we not? It was a dance. Anyways, for anyone who did not see what was happening, Ian and I were both muting and unmuting to give each other space at the same time. But no, I think Kelly talked a lot about it. I don't want to repeat it because I think she said it so well. I think it's tough because there's just so many competing needs. And so how do you balance basic things that folks are going to say they need, but then there are basic amenities that are also not being met? And what I mean by that is a real example here locally is people want to see a pothole filled, but people also think it's a basic amenity that a very different issue would be tenant support in helping renters. So basic service that is an expectation to meet, but basic service that should be met, but we don't have that structure. So I think there's a lot of conflict within that staff would love to think of more bigger things to bring in that could be basic amenities, but they're working with limited resources of how to support the current basic necessities to keep a city functioning. And so again, a lot of it to me is just dialogue of how do you build a coalition and how do you work together with existing residents who may be interested in those issues or existing city staff, and so that that work can work in collaboration and not necessarily in conflict with one another. So to me, it's just a lot of relationship building, and also recognizing it's, at the end of the day, a lot of these issues have been shared, so they don't need to be overtly engaged. There's people already doing that work, and it's more how do you build that relationship and trust to help support that work to continue.
Yeah, thanks, Grace. Really appreciate that perspective.
And I kind of responded to this question, like the last one, thinking about community practitioners who are working within local government, such as a public health agency, versus more neighborhood, grassroots type advocates. For those public health professionals, I think the role is to, bring the best practices forward, kind of in a professional sense. And of course, bearing in mind that best practices shift over time as new research, shows better ways forward. I'm sorry about the background noise here. And the role of citizen advocates is to represent the voice of voters and regular people in the community. And the government sometimes is out of step with regular people and regular voters. And so the role there is to organize and campaign. And a very powerful option for grassroots advocates is to bring forward a ballot initiative, which can change policy directly from the voters. It sort of bypasses the city council and the legislative branch. And some of the greatest steps forward happened because of a ballot initiative when the elected body was not willing to pass that policy on their own. They didn't feel, either they didn't support it or they didn't feel confident that it was really what the people wanted. And it was left to the grassroots advocates to educate the whole populace about an important change and get enough signatures to place the question on the public ballot and then campaign to win that vote.
Thanks, Ian, for sharing that. We're reaching the point where I want to allow our audience to pose any questions that they have. And I'm just letting you know, audience members, have patience with me. You can drop questions in the chat. You can raise your hand. I do want to be mindful of stopping the recording. I'm going to give a quick question to Kelly and Grace. I mean, really any of our panelists, but Kelly, you brought it up first initially with step 0. I mean, truly understanding the context and the policy making process. I am really curious how you actually went about doing that. What are the brass tacks? Oh, I called the city clerk and I asked these questions. I mean, that sounds so silly, but what were some of the things that you did?
Great question, Renee. So to be completely 100,000 transparent with you all, a lot of the information I gleaned came from, because again, COVID, you're sitting around. I was just trying to understand, I was working in North St. Louis County, living in St. Louis City. I'm just trying to figure out what the hell is going on with the restrictions. And I was doing some, again, programmatic work at the time. So I'm just trying to figure out what is happening here. And the city and the county clearly doing all the different things. And so it just got me questioning so many additional things as I started watching and paying attention to these meetings to get a sense of what was going on and who, what, when, where's, why. And oh, wait, you mean to tell me if these folks decide on this, these folks, oh, these are the people that passed the budget. Oh, and there's a whole season in the cycle. And oh, this is the process and how to, honestly, I always tell people, for me, I started with just, again, tapping into some of the local governmental meetings. They are all pretty much available on YouTube or Boxcast or some other online platform. And I just went down a rabbit hole after that. and just had a plethora and a whole lot of additional conversations, and used Google as my friend. And any people that I knew also that had experience or expertise in that space, I would definitely inquire to kind of find additional resources. And I just kind of started piecing things together from there. But I started with the videos. And then I just kind of went from there. And then, like I said, utilize a lot of resources. I have perused the city of St. Louis and St. Louis County websites entirely way too much for any, you know, probably typical resident in the St. Louis area. But really start there. And, you know, if you have additional questions, reach out to the contact information provided and other folks that are in that space. And some people were gracious enough to like entertain my questions, probably because they were shocked that someone was like really interested in learning more about the process and how things work. But yeah, I started with the videos and it just kind of went from there, Renee.
Thank you, Kelly. I mean, seriously, like it's different for each like municipality, and like, so bust out the charter. And Grace, do you have any thoughts on like a person who's like trying to just figure out like, how does this work? Who do I talk to?
Yeah, no, I think it's a lot. Huge appreciation for the mayor's office front desk staff. I've been shocked at the number of calls that they receive and field for us. So I think that while if you really had no idea where to go, one thing I would ask is someone check the city website and like see which department does what. But if it's someone who didn't have access to a smartphone or internet or any way to like look something up online before calling around, our mayor's office front desk staff is fantastic and knows like the appropriate entity of like who to follow up with on a question. And they do actually make sure those questions get forwarded to the right staff or city department. But you know, I think all cities approach this all very differently, but a lot of this information does exist online, whether it's the easiest to find or not. I think that is varying for a city, but that would be the first place I'd ask someone to go on our city website and search what they're looking for before just going around and calling different departments, because at the same time they do all of the different departments, like receptionists, front desk staff, get a lot of calls each day that don't necessarily pertain to the work of their department or agency they're representing. But so that's how I would suggest someone to get started, or meeting groups like Kelly's, like Transform 314, getting plugged into advocacy groups like hers that are doing great work to educate folks on how a bill is passed and what does it look like to get involved in government. I think there are many great organizations that are always on a weekly basis trying to do teach-ins and help people understand that. So if they really feel overwhelmed by the resources, the website, nervous about calling a random front desk, another really good way is looking up who your local elected official is that represents your ward or district. Most of those folks have staff that you can reach out to or them directly, and they're not going to say every elected official is perfect in responding, but that's another great way to get involved as well.
Thanks, Grace.
I don't have anything to add to those answers. The one thing I was going to add, but Grace, you beat me to it, was call your own elected representative who's there, you know, specifically to help you with those kind of questions and requests.
Thanks. I'm surprised there's no questions coming in. I mean, do you need me to physically stop recording? Because I'm going to. I'm just going to stop recording, y'all.